So talking about the World Lung Conference, this was a very important conference. In particular, as chest physicians, we have got a couple of interesting data which will change our management. Number one, we have got the results of the Nelson trial, which is the European screening trial for the early detection of lung cancer. And we have seen in a quite substantial number of patients that by the usage of screening methods, the low-dose CT scan, we are able to identify more patients with early lung cancer. But more importantly, we are able to cut down the lung cancer-related mortality. And this is very important because this will change health policies. We have to introduce screening also in Europe for lung cancer because now we have the second trial showing a reduction of lung cancer-associated mortality for regular and controlled screening. The second trial was focused on patients with ALK translocation. This was the ALTA first-line trial. In the ALTA first-line trial, patients with ALK translocations, untreated patients, were randomized between a novel ALK tyrosine kinase inhibitor, which was Brigatinib, compared to crizotinib. And we have seen a substantial improvement in progression-free survival favoring the treatment with Brigatinib, which was the primary endpoint. But also we have seen a significant and clinically relevant improvement in activity in the group of patients with brain metastasis. And this is very important because in particular in the setting of patients with ALK translocations, very frequently we do observe CNS metastasis. The third trial was about small cell lung cancer. We haven't made any progress in small cell lung cancer for more than 50 years. Now, in the IMpower133, we have seen a significant improvement in overall survival for the combination of chemotherapy and immunotherapy, Atezolizumab, compared to chemotherapy alone. And this data also will change the landscape of treatment for patients with extensive disease small cell lung cancer. And lastly, we have got an update for Pacific, which was the first immunotherapy trial evaluating an anti-PD-L1 antibody, Durvalumab, as a consolidation treatment after chemoradiotherapy in patients with locally advanced non-small cell lung cancer. And last year at the ESMO meeting, we have seen the progression-free survival data. There was a significant improvement. This year in Toronto, we have got an update on the second co-primary endpoint, which was overall survival. And we also have seen a significant improvement in overall survival favoring the consolidation treatment with Durvalumab. And this is the first positive trial in consolidation treatments for a couple of years. And meanwhile, Durvalumab has already been registered as consolidation treatment in Europe for patients with locally advanced non-small cell lung cancer after chemoradiotherapy if they have a PD-L1 positivity on the tumor cells. So 4 very important trials really will change our treatment.